Hey there, my name's Trevor Anthony Woller. I live in Beaverton, Oregon, and I have been dealing with chronic headaches now for over 4 years. So I am filming this video just to put it out on the World Wide Web. I don't know where it's going to go, but I'm desperate for some relief and for a diagnosis. And I'm pretty hopeless right now. I feel like I've tried everything possible to relieve my headaches, and they're getting worse. So I'm hoping that by putting this out on the ether, just in the ether and on social media, that someone might be able to watch it and help me. So I'm going to first just really quickly explain my symptoms. And then so that way you don't have to watch the whole video to know what my symptoms are. And then I will kind of go into brief detail about my history and my timeline and everything that I have done in doctors I've seen in the past 4 years. So the first thing to know about my headaches is when I get a headache, they do not go away on its own. Like literally do not. I know it sounds kind of crazy, but I'm not exaggerating when I say that. They don't subside on their own. The only way I've ever gotten relief from my headache is, number one, is specific chiropractic adjustments to the upper cervical area. Only some chiropractic adjustments, though some make it worse. I have gotten some relief from active release therapy, ART therapy in the upper neck, which is a specific modality of like a muscle release. And then the third, which is the one I've been focusing on lately, is fascia counter strain treatments, where it's kind of an aspect of myofascial release, but it's a specific modality to releasing all the fascial layers and ligaments and arteries that are in veins that are all related. I've gotten treatment in my head and my neck and my shoulder, and those have given me headache relief too. But once again, when I get a headache, it literally doesn't go away. I've had one last for 45 days straight until I got treatment. How I would describe my headache is, I'll take off my hat, is it's everywhere when I get a headache. I feel it a lot in my forehead right here. A lot of times I get it behind my eyes too. But predominantly I get it in my forehead, and then I feel it in the back of my head, like right here, if you can see along this line. And it's not like a pounding type of headache, like a throbbing headache, which I've had in the past, which some people can relate to migraines. It doesn't even really feel like normal tension headache either with the pounding. It is just this consistent, dull ache. So it doesn't really throb. It just, once it gets there, it stays, and it's just a dull ache. And the other sensation that I like to tell people is that I feel like I just have, my whole forehead fills up with pressure, and I just want to take a pin and like pop the balloon and like release the pressure. When I get a headache too, like I said, it's not just in the forehead. I also feel it in the back of my forehead, and then I feel it all over my neck. So specifically though, like in the upper parts of the neck, like Atlas and C1, where the neck connects to the brainstem, I get tons of tension in there and feel like a neck ache. And then I also get it down lower into the neck, a little bit like down here on this area of the neck, specifically the left side. Anyways, that's how I would define like my headache. Some other symptoms that come along with the headache is, I already kind of mentioned, is neck tension. I get it all the time here in the upper neck, and then down on the left side, predominantly in the lower neck. Here's a big symptom that I'm noticing lately is pulsing. When I get a headache, I feel my pulse all throughout my head at all times. It doesn't ever stop, especially when I'm laying down. When I lay down to go to sleep, I have to put a head or an ice pack over my head to distract myself from the pulsing, to kind of like drown out the noise. So I feel the pulsing in the temples just constantly when I'm laying down, right here, more on the left-hand side. I also feel it back here in the neck, like where the atlas meets C1, right here, I feel the pulsing. Um, and sometimes I feel those two are the main culprits right here. I also feel the pulsing here, and also sometimes I get it like right here on the back of the left shoulder cage. Um, Not so much on the right, but on the left. Um, and it just drives me crazy. And I know it's not normal to always feel like, and they're large pulses. Like it just pops out at me, and it's there all the time. I mentioned that I have shoulder tension. Um, the headaches really started when the first time I had surgery from a dislocated right shoulder. I had torn labrum surgery. And that's when, after that surgery, back in April of 2015. So now it's going on 4.5 years, is when the first sign of the headache showed up. Um, but the tension that I'm talking about, I feel it more in the left shoulder, specifically like here, like all up here. It's just, even right now as I press it, it is just so tight. And I think some of it's shoulder, and then when I go down more on the left-hand side, there's some rib cage stuff, but it is just crazy how tight it is. And when I roll that thing out on a ball, it just lights up, and no amount of rolling on a ball will actually release it. And it's always been interesting to me, but the left is what has been tighter than the right-hand side, even though that's where I've had all my injuries. And that could be from compensation or whatever, but that's a symptom. I get clogged ears when I get a headache. That's what made me think it was sinus-related headaches. 4.5 years ago, it was the first thing I checked, but specifically the left ear. Like, I feel like if I had to choose one side where my symptoms are worse, it's the left side. I feel the pulsing more here, the back of the shoulder, and then this ear. Every time I do this, it sounds like I'm unclogging my ear. Every time, but only the left, not the right. Fatigue is another symptom I get. And this one always made my physical therapist unsure of what was going on, because usually like fatigue is on the onset of a headache isn't really associated with tension type of headaches. But I get when I get a headache come on, it's like I have to take a nap to get through the workday or to get through the day. I am so tired, and I feel like even when I'm sleeping, when I have a headache, I sleep 8-9 hours and I wake up and I'm just dead. I have the hardest time getting out of bed. It feels like it's a different level of fatigue. Neck immobility, like this is me turning my right side, and this is me turning my left. My left is significantly tighter than my right, and it's been that way for so long, and nothing I do can get rid of it. And one exercise that some physical therapists gave me was this, where like I'm supposed to like kind of glide my neck out. Every time I do this, I hear a click right here. Literally every single time I do this motion. And I hear the click like right, I swear I'm not crazy, but it's like right here. Like these bones like in the neck and like right behind the ear. I hear a click when I do that. Don't know what that means. Another thing that symptom I've had is irregular blood pressure. One of the specialists I'm seeing for counterfascial strain, when he was testing my blood pressure, he did it on the left and the right hand side, and the right hand side blood pressure numbers were both 20 points higher than the left hand side, and they were both high, but the right was significantly higher than the left, which he said was highly unusual, that the body was having a hard time circulating. That one side was higher than the other. I feel like those are my main symptoms in terms of like the physical pain of what goes on with my headache. Once again, I don't know if I can reiterate in this enough. My headache does not go away on its own. It stays, which doesn't seem like a normal tension headache. Like no amount of like massage or stretching or ice or heat or any over-the-counter drugs, any over the Advil, actually any pain prescriptions I've tried, none of them help. And migraine, I've tried migraine medicine too. I guess so. This is the end. This is the end of my symptoms. Those were my main symptoms. And you can review this on the Google sheet that I have written up. That's linked to wherever I post this video. Um, but um, so it's already been 10 minutes. But I'm just going to keep going on my history, just in case anyone actually wants to watch a 20-minute video about this. Migraines, I've tried the Ajovy, like where you do the shot to yourself. I've tried amitriptyline. I've tried Maxalt. I've tried Cymbalta, and none of them actually done for the help my headaches at all. So no pain medication literally has ever helped with my headache. The only way I've ever been able to get relief is through chiropractic or fascia counterstrain treatments. So it doesn't really scream migraines to me either, because migraines are like pounding, like you have light sensitivity and nausea and you literally can't get out of bed. I don't have that. Once again, mine's like a consistent dull, like just brain fog. It's just like stuck. And I don't really have that much nausea. Every once in a while though, I do get it. But it's not the norm. But I don't really have any light sensitivity. Anyways, so neither of them really scream traditional migraine or tension type headache, but this video would be 40 minutes if I talked to you about my entire history. So I guess I'll leave that detail for the Google doc that I have. But in summary, as much as I can summarize it, I have had the first time I dislocated my right shoulder, I was rock climbing in a slot canyon in Utah, and it had just rained out, so my shoe was had mud on it. So I was trying to like climb on top of a boulder and put my foot up on top of a boulder. And as I tried to climb up, my foot slipped, so I started falling back down. And my friend was already on top of the boulder, saw me fall, grabbed my arm, and tried to pull me over the top, and just that ripped my shoulder out of the socket. So it was a pretty traumatic event. I don't know if there was any whiplash involved in the actual act. There could have been. I mean, it wasn't your normal, I feel like, type of dislocation. It was dislocated for 7 hours because we were stuck in a slot canyon and I had to hike 3 miles out of a slot canyon, which meant I was lucky that I had 10 people with me. That literally there were spots where they had to carry me down like a ladder. My shoulder and my arm started to turn purple the longer that we were out. And I just tied a jacket around it. And then anyways, it took 7 hours to get to the nearest clinic to pop it back in. That was in February 2014. I did rehab on my shoulder. Never really felt right. Continued to play basketball. Never really felt right. So I dislocated it again for the second time about a year later in January 2015. So I had my first surgery for a torn labrum in my right shoulder a year after the first accident in the slot canyon in February 2015. After that, went through traditional physical therapy, and my first headache started to show up in April 2015, right after, a couple months after that first surgery, and had no idea that it was involved anything with my neck or my shoulder or anything. I assumed that it was just sinus related, because once again, it's like predominantly a lot in my forehead, and I also get it around kind of here, and ears are clogged, and I have really, really, really bad hay fever. So I just thought it was sinus related, so I just kind of went on, saw a doctor, but it got bad enough that I saw a doctor, and he did x-rays of my neck and skull, didn't see anything, told me to take Advil. So this was just kind of my life. The headaches would come for 3 to 4 days. They would last about 3 days. Every month they would come by. So a nuisance, annoying, but I guess not enough to really dig into it. Shoulder never really felt right. April 2016, I got into a car accident. I got rear-ended. I was completely stopped on a highway. Everyone had pulled over because an ambulance was coming by, so everyone had pulled over. And as soon as the ambulance was going by, I put my blinker on, started to creep out and pull out. But a pickup, I was in a small Hyundai Elantra, a huge pickup truck behind me, the one directly behind me, was impatient and wouldn't wait for me So he was just pulling out and just rammed right into my trunk. So I was probably going 5 miles an hour. He must have been going 20 to 30. I don't know, but no airbag deployed. I didn't really feel anything afterwards, but it definitely was a powerful like force and kinetic energy because my entire trunk was smashed in. Like I couldn't shut the trunk after, and it took 6 weeks for my car to like be fixed again. And right after I got in an accident, literally, I was driving on to way to play early morning basketball, and I went and played after because I didn't really think anything of it. I point that out there just because I don't know if it's played a role in worsening my headaches. I've talked to some people who theorize I have post-concussion syndrome, whiplash syndrome, and that could be playing a part. And I know that some people say sometimes those symptoms don't show up for months after. Anyways, that was April 2016. Up until that point, I just kind of stayed in the same pattern of about every month. I'd get 3 to 4 days, I'd get the headache. Didn't really know why. Then in February of 2017, my shoulder never felt right during this entire time. I had a couple more subluxations. I didn't know what was going on. I dislocated my shoulder again playing basketball completely for the 3rd time in February 2017. I got my 2nd surgery on a torn labrum in March 2017. So basically the same surgery again. I retore it, but this time I also had a Latarjet procedure done, which is a bone graft sawed off from my clavicle and then screwed to the shoulder bone to help lock it in. And the reason for that is my orthopedic noticed significant bone loss, which he hypothesized is it's rare, but some people have an adverse reaction to the anchors that they use when repairing your torn labrum, and he thought I had an adverse reaction and ate away at the bone. So we had to do that. So this is March 2017. I went through physical therapy again, and this is when my headaches, I feel like, went from a nuisance that was coming from every month for 3 to 4 days, I'd get it, to jumping up to like it was inhibiting a lot of my life. And this was around May, June of 2017, basically when I was in rehab for physical therapy for my 2nd shoulder surgery. Now headaches were lasting 2 weeks. And they were coming every 2 weeks. So it was much longer duration, not as long of a break. And the first thing that came to my mind was just physical therapy related, that it was setting off a headache, that he was just focused so much on my shoulder and he didn't really take into account anything in my neck, that it was just flaring up my neck. And so I stopped physical therapy as I tried to figure it out. I went to an ENT during this time to a sinus CT scan of my sinuses. Nothing. Tried a bunch of allergy medicines. Didn't help at all. I went to a primary care doctor, prescribed me Sudafed. Nothing. Didn't help at all. Finally, I had a headache for literally 40 days straight. This was from August basically up through Labor Day weekend in 2017. And I was miserable. And I posted on Facebook for the first time and said, can anyone help? My ears are clogged. I have this consistent dull headache, and it doesn't go away. And my friend recommended me to an upper cervical chiropractic specialist who does a NUCA treatment, and did x-rays, said I had military neck, adjusted me only on the left-hand side on the atlas, and within 20 minutes, my headache was gone. And I was stunned. And I had relief for about 2 weeks. And I honestly thought I found the answer. I thought I'd have to see him, 15, 20 times, and then maybe see him periodically the rest of my life, but not a big deal. But I started to notice that after a few months seeing him, I'd only get relief for about 2 to 5 days and it'd come right back. And he was only adjusting the atlas. During this time period, I also saw a neurologist and got an MRI of my brain. I saw a PA neurologist, but the MRI was normal, nothing abnormal. And I told her that I got relief from a chiropractic adjustment, which might have been a mistake on my part because she just took that as, oh, you have cervical headaches. Go to physical therapy and here's some pain medications to try to see if it helps. Amitriptyline and Maxalt, none of them helped. And once again, physical therapy wasn't helping before. So, but I felt like I needed to see a new chiropractor who wouldn't only adjust the atlas, but address other parts of my body. So I found I went to a couple who literally made my adjustments worse. Sorry, my headaches worse. Their adjustments they would just like twist the neck, and that would make it work. Make it worse. I finally found a chiropractor that uses a Thompson table. So I'd be laying face down, and then he would be, using specific pressure points, and then drop with the table, and that's how he would adjust me. And he was able to get rid of my headache too, doing that. But he would also address other parts of my body. So it wasn't just the atlas that was out. He'd always address like C3, C4. It would always be laterally rotated. But also every single time, I'm telling you, this left side, my ribs were always popped out on my left hand side. You'd always have to pop those ribs back in. I started to feel like I made some progress with him. I would go more like, sometimes I was going like 2 to 3 weeks in relief before another headache came, but still stuck in this pattern where I wasn't really getting better. So I really trust this chiropractor. He's a great guy. And I asked him, he referred me to his favorite physical therapy clinic. I went in there and, was hoping that this was, I finally kind of pieced everything together. And if I had a physical therapist who was aware of what was going on, we could be cautious about my rehab and not do anything to set it off, and also focus not just on the shoulder, but the neck. So I went in there, and great clinic, great physical therapist. They were stunned when they saw me. When I took off my shirt, I had extreme asymmetry in my neck. She said it looked like I had scoliosis. And not only in my neck, my rib cage on my right-hand side, not my left, was caved in. Like, she was stunned. And so for the first 2 weeks, I did breathing exercises just on my bed to like kind of help fill out the rib cage again. But my entire right side was atrophied. My rib cage, my neck muscles, my shoulder muscles, and my pec. And I still have that atrophy today. And my pecs, my right-hand side is still considerably weaker than my left. So for the first 2 months, I didn't even do any really shoulder exercises. I just did neck stabilization, asymmetry, and then doing some other stuff to kind of find my balance again. And then I slowly got it into shoulder strengthening, but we had to be really careful because there were some exercises like when I would stand on one foot and do dumbbell raises, I would shift, my whole body would shift, and she would see my neck shift into functional scoliosis again. So we had to be super, super careful. And this is when I was all moving, I was underneath the theory that physical therapy was setting off my headaches. And so I was trying to be really careful. So whenever I got a headache, we would tone it back and be really careful and all this different type of stuff. And it was just back and forth for a long time. But I had we felt like we finally find the right sequencing pattern on when to progress. And I was finally getting into more actual girdle strength with weights in my shoulder and my neck, making progress. The atrophy was slowly improving. And I had 8 weeks without a headache, and I was just so happy. I was like, I'm on my way. I'm getting there. Just got to finish this rehab. And I went on a run. This was about February 2018. So it had been basically a year since my second surgery. Went on literally just a 2-mile run. That's it. And headache came back. And it was, I had the headache, but I specifically felt different, it was a different feeling, my neck muscles more than ever before were super tense in the headache too. So I went back to the chiropractor, got it out of the way. Thought it was a minor setback, just had to be careful. Then all I did was shoot hoops. I didn't even play basketball. I went and shot hoops for 20 minutes. Headache came back. Same thing again, went to the chiropractor, got it adjusted, went away. But after that, I got stuck in my pattern again where whenever I get a headache, it would last, just wouldn't go away. And the chiropractor adjustments would only last 2 to 7, a week, between 2 days and a week again. And I was all this progress I was making, where at 8-week free headache, it just wasn't happening anymore. So we scaled back down the progression of the weight therapy. I tried to do a lot of traction during this time, neck traction I would do there. She would do some Graston technique on me for soft tissue. None of it got rid of the headache. None of it helped. And so I just felt like I had taken 8 million steps back. Finally, so this was happening, like this was between February 2017, and this whole process went through basically July 2007. Sorry, this is 2018, February 2018 to July 2018, where I was just like going back to the physical therapy and wasn't making any progress anymore. I did yoga. I took a yoga class from the same clinic twice a week for 10 weeks. That would hope, would open things up, and nothing was working. And finally, I got to the point where I was like, I don't even know if it's physical therapy that's really setting off the headache. Like maybe it's contributing to a little bit, but I don't think, like, I was getting headaches even when I wasn't doing physical therapy. I go get a chiropractic adjustment, be sedentary for 4 days, and get a headache. So I started doing more and more research, and maybe hypothesize I've got to work on the muscles and the scar tissue. If those aren't ever taken care of, then it will just continually pulling my neck out of alignment and causing a headache. So I went and got some active release treatment therapy, especially in the upper neck. The first time he saw me, he's like, "Man, your muscles are screaming. There's no way that these muscles in your neck cannot be contributing to your headache." So I thought, once again, I'd found the answer. Got to do some ART treatments, just get those muscles to calm down, and then I can go back into physical therapy. So did that, and the ART treatment most of the time, sometimes it didn't, but most of the time also provided relief from my headache. And I slowly started getting back into physical therapy, helping that, but I couldn't get out of this pattern where the relief would only last like 5 to 7 days. And once I got a headache, once again, it didn't go away unless I got treatment. And so I went, during this time, I got referred to a new neurologist and got an MRI of my neck. Beforehand, I got of my head. I got one of my neck. Nothing abnormal. Neurologist really didn't really say much, and prescribed me Cymbalta and a high, a prescription level anti-inflammatory, because she diagnosed me with a musculoskeletal headache. Didn't do anything. Didn't help at all in medicine. So she referred me to another neurologist who did an EMG of my right shoulder and neck, because my physical therapist had always wondered about a nerve stretch or nerve injury because of how much atrophy I had on my right-hand side, and the EMG came back normal. Neurologist didn't really say much. So I felt like I was completely stuck, and I didn't know what to do. No, the pain medications were working. Neurologists were saying MRIs are fine of neck and head. You must have a musculoskeletal headache. You just need to work through it. But I couldn't process that in my mind, because when I get a headache, it literally doesn't go away. And that doesn't seem like a musculoskeletal headache to me. And why do no medicines help with it? Nothing over the counter. Massage doesn't help. Ice doesn't help. Why? And so I just felt lost. During this time, I tried some migraine, like the Ajovy treatment too. That didn't help. And I forgot to mention, throughout this past year time period, I had been getting massages every month in the shoulder and neck. And man, was I just, every time she did it, I was just sore and just so tension everywhere. Nothing really helped. So this is bleeding into August of 2019, this past year, and I'm just hopeless. Don't know what to do. So one of the chiropractors recommended I go to a naturopath and try some biopuncture, which is trigger point injections in the neck to get the muscles to calm down. Did that 3 times in the upper neck and lower neck and in the shoulders. Did a bunch of biopuncture shots, never helped. Never tried prolotherapy with her, that naturopath. I guess it's something else I could try if she's recommended that, if the trigger points didn't work. I went and saw a different naturopath. It's called a regenerative medicine. He did a ultrasound of my right shoulder because he suspected a brachial plexus injury. And the brachial plexus, according to on the ultrasound, according to him, showed that it was injured. It was stretched. Didn't look like a normal nucleus of a brachial plexus. It was stretched out. So he wanted to do some PRP shots to brachial plexus, which he's a great guy. Once again, I believe what he saw in the ultrasound was true, that there was this right brachial plexus didn't look normal, but thousands and thousands of dollars, and I don't even we couldn't fully piece together why that would be causing my headaches. So I felt lost. And here I am, my friend referred me to a counter fascia strain specialist. Um, and I saw her the first time in September 2019. She was a former physical therapist. Now she does mainly sports rehab through fascia counter strain. I had no idea what fascia counter strain was. Still don't fully understand it. So I went in just thinking it was another physical therapy appointment. Wasn't going to help. Same old, same old. But she went in, and I realized it wasn't normal physical therapy. In fact, it was all hands-on treatment. And I'm going to do a poor job explaining what fascia counterstrain is, but basically the whole theory is that fascia is the connective tissue throughout our body, and it's everywhere. It wraps around our organs, our hearts. It connects ligaments together. It's like surrounded all the muscles. There's visceral layers. There's deeper, like top layers of fascia, and there's lower layers of fascia. It's everywhere. And there's huge like layers, like some layers of fascia go from your neck all the way down your rib cage. Like there's some layers of fascia apparently that are connected from the kidney up to the neck. Like it's all intertwined, and throughout all that intertwined, the fascia passes through nerves and arteries and ligaments. And so this whole theory is that the fascia has constrictive properties. And so fascia, just like muscles, can constrict, and when it constricts, it causes pain. And it goes in that protective mode, and it can cause pain and tension because it's restricting the muscles it's around, it's restricting the vessels that it's around, the blood vessels, it's restricting the arteries that it's around, and there's a bunch of these other systems that are considered fascia, and like tiny ligaments that connect the kidney to something else. So how fascia counterstrain works is they use like the bones of your head as a roadmap because apparently there's a relationship between how rigid and how the bones of your head feel to all the different like fascia layers and systems throughout your body. So I would lay down there, and she would do what's called a cranial scan and go every inch of my head, like every single part, and she'd do here and be like, oh, does that feel rigid to you? And be like, yeah. She'd be like, oh, that's related to C1. And then she'd come down here and be like, ugh, she feels something up here, and then she would feel something in my finger, and she'd be like, is that tight? I'm like, yeah. And she'd be like, anyways, it's crazy. It's a crazy treatment. But I walked in there, and at one point she's like, is this suit tight? Like around C1 in my neck. I'm like, holy crap, that's so tight. And she she didn't just like release C1. She like found this whole fascia layer that was connected to C1, used hands-on, restricted it, brought it back to normal, and the tension immediately afterwards was gone. And I walked out of there, my headache was gone. And I was stunned. I felt like it was a miracle. I almost felt like it was voodoo magic. And I thought once again I had found the answer, that I had fascia. I just had that the muscles and everything else wasn't like the number one cause, the root cause of my headaches. It was when I got in the car accident, and when I got in the my first shoulder dislocation in the Slot Canyon when I was out for 7 hours. That was a traumatic experience. In my body in protective mode, the fascia just constricted everywhere, and the other dislocations just kind of stacked on top of that, along with the car crash stacked on top of that, and it just, my body had enough, and that there was just fascia restrictions everywhere, and thought I would have to, after a treatment with her, I'd be golden. And what really made me confident in that is after the first treatment, I didn't have a headache for 2.5 weeks. Didn't have a headache, which I hadn't had for months. I hadn't had for basically like 7 or 8 months. I hadn't gone that long, and I was just so stoked. And I was feeling good, and I wanted to test things out, so I played pickleball, light pickleball with some friends for like an hour on one Saturday morning. Then 4 hours, my headache came back. One thing I forgot to mention throughout all of this is whenever I did any physical activity, you might have been able to pick up that basketball, running, hiking, any type of physical activity with increased blood flow causes set off a headache. But this pickleball set off a headache, and I was disappointed. But when I went back to the specialist, she's like, I think that's normal. I think that's good, and that gives us a good sign that part of the reason what's going on with your headaches is that the blood when you get an increased blood flow, it just gets stuck and you're not be able to get it out. And that's what causes your headache, and that's what causes that constant pulsing in your head. So we worked a lot. There was tons of stuff on my left-hand side of the fascia that was restricted, tons of stuff in my ribs. She did stuff all over my neck. She did stuff around my kidneys and livers. And when I say stuff, like releasing fascia and these other symptoms, she did stuff like on my hips, tons of stuff on my hips. She even released some stuff, fascia layers that go down to your toes, that relate to other stuff. And every single time she like was doing her scan, she'd be like, "Oh, that feels tight." I'd be like, I would validate and say, "Yeah, that was." And she would go to the corresponding point. Like one of them, she would feel up here and go down to my toes, and my toes would like light up. I'd be like, "Oh my gosh, like what are you touching?" And then after she did her treatment and released it, like it feels significantly better, which seems like a positive sign to me. Anyways, I went about like 12 times treatments to her, which are like 2 hours long. And after the first treatment, I had like 2.5 weeks of headache free. Now I was only going like 3 to 4 days again. And I felt like I was stuck in the same pattern. During this time period, so this was September 2019 when I first started seeing fascia counterstrain. And during this time period, I started seeing a new physical therapist. I just wanted it was referred to me by a friend. I wanted a fresh set of eyes, what was going on. And I tried to play this game again where I was like, oh, I have a headache. I don't want to go to physical therapy and make it worse. Or we need to be really careful in physical therapy about my progression so I don't set off a headache. But over time, and basically like this November, I realized I don't even know if that's really true, because I get headaches if I'm not doing anything. I get headaches if I do physical therapy, and physical therapy doesn't necessarily make them worse. There's probably some instances when physical therapy set off the headache, but a million other things also set it off. And when I do nothing, I get a headache. So I'm now going back to physical therapy and just putting my headaches out of the equation and just focusing on finishing the rehab on my right shoulder and my neck and my asymmetry, and just hopefully knock that out of the part so it's no longer an equation, part of the equation. But anyways, it's late November. It's around Thanksgiving. I have a headache the day after Thanksgiving for the rest of the break. And I go back and see this specialist again. And I'm like, I feel like, why can't I get over this hump of 3 to 4 days? And then the headache comes back. And she was doing her scans, and she felt like for the first time that popped up were some stuff in the head and the brain, some arteries and stuff in the brain, lymphatic system up there. And so she referred me to another fascia counterstrain specialist in Portland who has the training to release that stuff in the brain. So I saw him. He said he felt a lot of stuff in there and released some brain artery stuff along with other neck stuff. And yeah, I got relief from his headache again. And so I was feeling good. I was like, this was the root cause. Makes sense. Like I always had post-concussion syndrome, and all the other stuff like comes back to what was going on, concussion in my head. But I got only relief for like 3 to 4 days. So I went back to him. I did some similar stuff, got relief for 3 to 4 days, and it came back again. So this is where I'm at now. And the last time I saw him, this different fascia counterstrain specialist, he didn't really do anything in my head. He felt like he didn't feel as much in my head that was pointing out to him anymore. But what was striking out to him was a lot of vital organs, which was like kidney and liver and gallbladder and adrenals. And he didn't think they were functioning right. And what he means by that, he doesn't think they're diseased or anything kidney disease, but they were irritated, and the fascia around them were significantly irritated. And he did one treatment where, and once again, every time I'm doing these treatments, he'd like feel something in my head and he'd be like, is that tight? And I'd be like, yeah. And then he'd go like right behind my back, like the back where it's like the same level as the kidney is, and he'd feel around there and he'd be like, is that tight? And I'd be like, oh my gosh, that just jumps out. Like I want to jump off the table. And then he would come to the kidney or the liver and kind of does this treatment where he releases it in, and then he'd go back to that point on the back and the tension would be significantly less. And he'd do all that. And there was actually one time, this past treatment, where he did it, and one treatment that he did on some stuff to the kidneys, I can't remember if it was the kidneys or the livers, made my neck better. And he's like, yeah, there's a lot of these organs share the same fascia structures as well as the same interways to the neck, specifically C3 through C5. And so if you have issues down in those organs, it will light your neck up. But I was like, how does this relate to my head and everything? And I don't know. But anyways, his theory that he thinks is also a contributing factor is, for some reason, these vital organs, specifically the kidney, liver, and adrenals, are not functioning well. And because of that, there is a chemical imbalance in my body or blood toxicity. And from what he says is that there's two ways you can irritate fascia, is one by an injury, but there's also like chemical imbalance or blood toxicity can also irritate the fascia surrounding the vessels and the arteries and the organs, and cause them to restrict the same way and go into protective mode because they have those chemicals and irritants. So he thinks that those organs were either in the whiplash of the car. How he explains it, it's just like the head can get a whiplash concussion, so can all the other organs when you're launched forward. And they were restricted, and because of that, they had to work overtime and not been working very well. And for some reason, there's like an underlying chemical imbalance or reason why I'm getting constant, like why my treatments aren't holding, and why they always come back and the same like trigger points are irritated. He thinks that's why nothing's holding, is because there's an underlying thing. I don't know. So I'm going to see a naturopath now, where I'm going to do a blood test, a different type of blood test, I guess, to see if there's anything underlying there. Regardless, I feel totally lost. As you can see, I just spent another 25 minutes explaining this. If you've watched it all this way too, God bless you for doing that. I don't know what to do. So here I am recording myself at 12:30 a.m. on a Thursday morning because I can't sleep because I have a headache, and I'm just completely lost. I don't know what next step to take. So I am doing a selfie and putting it on the internet and praying that someone sees this and can help piece together a puzzle. I don't know. I just don't know. And this last treatment I got from the fascia specialist, where he did stuff on the kidneys and liver again. Oh, and another thing why he thinks it's related to that is when he took my blood pressure, he took it on my left side, and he said, that's way higher than it should be for a healthy young guy like you. It was like 130 was the top number, or 135. Then he did the right side, and it was 25 points higher. It was like 155, 160. And he's like, that is not normal, which makes me think there's a circulating issue. Something going on with those organs. And then after he did his treatment, we took the blood pressure again, and the two sides were normal. So maybe there is something going on with that, but I'm still having a hard time connecting that between, like, right now I just feel this tension in my bottom of my neck, and obviously the headache, but just constant tension all the way up here. And this last treatment he got from me, the relief literally only lasted an hour. Sorry, a day, one day. And I knew it was only going to last a day because as soon as I got home and the headache had subsided from like a 6 to like a 1, so it was basically gone, but the pulse never went away. Pulse here, the temple, pulse in the upper neck, and even sometimes I even feel it right here. It just at all times, which is just a clear signal to me that the headache's going to come back. And whenever I feel that, the headache comes back, and it did about a day later. And the pulse, I don't know why. He doesn't even know why. We don't have a guess on what is happening, if it's a vascular reaction or what, but it seems like there has to be something to do with blood flow, because this pulsation in the head and the neck is just a signal for it's having to work so hard to like get blood up there. But why? Is it still restricted? Is there still something going on with the head that's restricting everything else? Is there something chemically that's making this problem? I don't know. I don't know anything anymore. I was certain that it was just, issues with neck muscles, and that once I figured out the asymmetry and made it stronger, it would go away. That didn't happen. Chiropractic care was never a long-term solution. Like I'm exhausted because everywhere I go, like there's something else, and no one knows what the root cause. And I've been dealing with this for so long now, 4.5 years, that I go into any treatment and I just expect it not to work. And I expect to be in this constant state of tension with the headache and neck immobility and tension in my shoulder and just not being physically active. I've literally been sedentary for like 3 years now because of the headaches. And I just want to play basketball again. I just want to be able to go on a hike and not get a headache immediately after again. I don't know. I don't know what to do. So if anyone out there can piece together all these symptoms and my medical journey, and I would be forever eternally grateful for any help. Once again, I have to end on this note. My headache does not go away. It stays. And it's not horrific enough like a migraine that I can't go to work, but I've been functioning at like a 50% capacity for years now when I have these headaches, because it's just there and it does not leave. It never goes away. I hope that's a key clue, because that doesn't sound like a normal tension or migraine headache. And if it was just related to stuff in my neck, like I've literally gone to a chiropractor over 100 times. I've literally gotten 20 active release treatments on my neck. I forgot to mention that I've seen an acupuncturist. I've gotten acupuncture over 10 times for the neck. I have gotten so many different massages. I've gotten trigger point injections for the neck. I have done an MRI of the neck and then nothing shot up. Like I have 12 foam rollers and balls over here, and I roll out, and nothing ever helps that. And the tension in the neck and the shoulder, specifically like the left, does not go away. And so that just makes me think there's something else going on. I don't know what it is. So that's my spiel. Once again, my name's trevawoller. I'm in Beaverton, Oregon. My number's 503-410-4329. I'm just throwing out my number to the internet, but I don't care. My email's trevawoller, trevawoller @gmail.com. And if you can help, thanks.